1 in 4 women and 1 in 10 men experience interpersonal violence. Keep in mind, this violence comes in different forms. It can be sexual, physical, emotional. And at the start of the pandemic, when we were all stuck at home, more people found themselves looking for help because they were spending more time with their abusers. Our Sydney Stallworth shares what resources are available in this week's Mental Health Monday.
We're about a year into the pandemic and a lot of places are opening back up, which is great. But all in all, we're still spending a lot more time at home than we normally would. And this can be a very scary situation if your home is not a safe space.
At the beginning of the pandemic, we saw about a 25% increase in our calls related to domestic violence.
We met with Becky Cecil from Crisis Services of North Alabama, and at the start of the pandemic, they were hands-on in helping meet the demand.
Our domestic violence responders were going out with police more often to domestic violence calls. We were getting more calls on our helpline.
Calls have started to trend down as the pandemic continued, but CSNA says that could just mean less incidents are being reported. They want you to know you do have advocates locally, and they have a lot of ways you can reach out for help. They're all quick and confidential.
One of our biggest programs is our helpline. We kind of consider it our front door because our helpline is 24/7, 7 days a week, 365 days a year. We will have a staff member or a trained crisis counselor available. You can get services. If you need to go to our shelter, they can refer you to our shelter. If you need counseling or a support group, they can refer you to that. If you need a court advocate, they can refer you to that. We want our clients to feel safe coming to us, that we are not going to give their information to anybody. We are not going to let their abuser know where they are. If they call our 24/7 helpline, they don't have to give us their name. They don't have to give us any information.
If you need to talk but don't feel comfortable or safe speaking on the phone, CSNA has a text line. That number is on the screen. And this is their website. They've considered the risks that come along with looking for help while at home with an abuser.
We have an escape button so that if somebody is looking at our services and say their abuser walks in, they have a one click to get out of it.
And if you're worried about how you'll pay for these services, don't.
Our services are all free. We never charge for our services because we realize when somebody is going through something traumatic, something that a lot of us can't even imagine, we don't want them to have to figure out how they're going to pay for it.
When Becky and I were talking, she brought up the fact that when people hear the words domestic violence, their first thoughts go to physical abuse, but emotional abuse is very real and just as dangerous. We want you to know you have local resources that are available to you. You can head on over to RocketCityNow.com for those links. With your Mental Health Monday, I'm Sydney Stallworth, WZDX News.